confirmed COVID-19 cases with evidence of community transmission. The Baltimore City Health Department's response to COVID-19 remains focused on community mitigation as well as preparation for potential hospital surge. Our focus on community mitigation is in an effort to decrease the potential for further spread of COVID-19 to residents throughout our community, with a particular focus on protecting those at highest risk for severe complications, including adults over the age of 60 and those with underlying health conditions such as heart disease, lung disease, and diabetes. As we consider the needs of older adults, we recognize they may be challenged with having some of their most basic needs being met, especially in light of adopting social practices. Under Mayor Young's leadership, the Baltimore City Health Department has expanded the capacity of the Maryland Access Point Hotline, also known as the Mapp Call Center. The Mapp Call Center is available to assist older adults who require groceries, check-ins, and other essential needs as we support the widespread adoption of social distancing. Deputy Commissioner Hyung Tan will give more information about that expansion a little later this morning. I encourage all older adults age 60 and up and their caregivers who may need assistance during these times to call our Mapp access line at 410-396-CARE or 410-396-2273. You can also visit our website to find out more information at health.baltimorecity.gov. Social distancing remains the most important step everyone in our community can take at this time to decrease the number of people who become ill. Social distancing is intended to slow down the outbreak of COVID-19 in order to reduce the chance of infection among high-risk populations and to reduce the burden on our healthcare systems and our healthcare workers. If you must go out for an essential reason, stay at least 6 feet away from others. If you and someone standing next to you can extend your arms and touch one another, you're standing too close. Even if you are not a high-risk individual for developing more serious complications from COVID-19, and even if you are not currently showing symptoms, you may accidentally spread the novel coronavirus to a loved one who is at high risk. So please use your best judgment and practice social distancing. Every Baltimore resident has responsibility to keep our community healthy. Your social distancing behaviors and the social distancing behaviors of the community at large that we implement today will determine the path this takes. We must protect our healthcare system and ensure it does not become overwhelmed, and we must also protect the health of our loved ones. Thank you.
Chief Ford. Good morning. I want to make everybody aware that the fire department is still running calls. We still are at the level we normally work at. Nothing has changed as far as our responses. Nothing has changed as far as our staffing. So the fire department is still out taking care of people and exhibiting pride, protecting people. Just as Dr. Girazza said, we want to encourage the public to acknowledge social distancing in order to slow the spread, in order to flatten the curve, to ensure that we do not exacerbate just not our EMS system, not just our pre-hospital system, but also our hospital system as well, to make sure that we can care for our loved ones, make sure that we're conscious of the people who are possibly susceptible to this in a very negative way, like the elderly community and those who have pre-existing illnesses. The last thing I want to point out is that, and I'm going to harp on this over and over again, is that 911 is used for the emergencies. Historically, we have many times teetered on, not everyone, but certain instances, people teetering on use to misuse of the 911 system. 911 system is for emergency calls or for emergency responses. So please keep it limited to that, because when people misuse or abuse the system, it takes resources and life-saving care from one area to another one where people really need us to be at. And we want to make sure our members really want to make sure that we make a difference in the community on a daily basis. So at this time, I'd like to introduce the OEM Director, Acting Director, Chief Savala.
Thank you, Chief. Okay, so I don't have a whole lot of changes from the other day, but a couple of them. We're going to be going live today with the donation portal through our 311. So if there are organizations out there that would like to donate for the cause, we will be providing instructions shortly on that. We're continuing to work with the medical community and the Maryland National Guard and the state to prepare for additional treatment areas and or testing sites. We're continuing to coordinate our resources, requests from city agencies and partners from the city. As a matter of fact, yesterday we were just able to assist the police with some of their requests to get them the resources they need to get out to their police officers, and we're providing the training that they're going to need for that. And the Emergency Operations Center is still 24/7, fully operational, and will continue to be that way until we get through this. Thank you. Commissioner?
Thank you, Chief, and good afternoon. The Baltimore Police Department is committed to meeting any public safety demands during this COVID-19 pandemic. We are working diligently to ensure our officers are being proactive to minimize exposure to COVID-19. Recently, there have been rumors circulating concerning the Baltimore Police Department and a member of our department testing positive with the coronavirus. As of today, we have no confirmed cases of a member testing positive with the coronavirus. However, given the nature of this virus, it's possible that this could change. We're continuing to monitor all of our officers. This includes those who have called out sick due to illnesses or exhibiting any symptoms related to COVID-19. Under the mayor's leadership, the city has set up hotel rooms for officers and first responders that may have been exposed to the virus or displaying some of its symptoms. We're also lending our support to all of our officers through our health and wellness unit and through other avenues. The BPD COVID-19 task force is fully operational, with daily inventories being conducted of supplies, and additional supplies are being ordered and distributed. Prioritizing those in the agency who interact most frequently with the public. We've experienced some delays in the shipment of some of the equipment and supplies, as the entire world is seeking the same supplies at the same time. To ensure that our officers continue to receive guidance on their personal protective equipment, we've produced 3 guidance videos with more videos planned. The Baltimore Police Department continues to keep our members and the public informed of where the agency stands with our COVID-19 response and our actions. And just for your information, we have distributed 250 kits to all of our patrol cars, district stations, and divisions. Within those kits contain masks, gloves, hand sanitizer, disinfecting materials. Thanks to the fire department, we want to thank you. We received 3,000 N95 masks just yesterday. Officers are being fitted, and we want to say thank you to our fire department for that donation. 2,000 masks are being donated by Home Depot as we speak right now, and more equipment and supplies are being ordered throughout EOC. So thank you.
Thank you, Mr. Chief. Thank you to our fire chief, our commissioner, and our health commissioner for the great work they are doing under these extreme circumstances. As most of you know, school closing and senior centers put a tremendous challenge on government. To ensure our residents, both children and older adults, still have access to healthy meals, my team hit the ground running and quickly came up with a plan on how to deliver meals to all population and build the capacity to make it work. And they are continuing to build that capacity to deliver even more meals to more areas of our city. This past weekend, we distributed nearly 10,000 meals at Rex and Parks food distribution sites across the city. And we distributed over 1,900 meals in partnership with the Maryland Food Bank, Meals on Wheels, and the Salvation Army to seniors across our city at their homes and at senior centers. Now I will turn it over to Holly Freestad, Food Policy Director for Baltimore City, to talk more about our efforts. Holly?
Thank you, Mayor. Hi, I'm Holly Freistad, Food Policy Director of Baltimore City. I want to provide an overview of the city's emergency food response to COVID-19 to make sure our food insecure residents get the food and meals they need. The 3 priorities are children and families, older adults, and other food insecure residents. Since the start of the COVID-19 emergency food response effort, with our partners, we have served over 53,000 meals at 92 sites throughout the city. In addition, tremendous amounts of food are flowing through the food bank through a network of nonprofit partners and community-based sites. In the past 2 weeks, they have provided 3,500 senior boxes, 500 backup boxes to families at school sites, and this month have moved over 800,000 pounds of food, which is equivalent to 18 trailer truckloads into Baltimore City alone. We continue to collaborate with multiple city agencies, nonprofits, community, state, and federal partners to continue increasing the number of food insecure residents fed daily. I want to take a minute now to talk about food policy and the changes to SNAP, otherwise known as food stamps. The city and Mayor Young worked for months to oppose the limits to SNAP, and I am thankful through our injunction, as well as the Coronavirus Relief Act, the 15,000 able-bodied adults without dependents, ABODs, that were facing changes to their SNAP benefits as of April 1 will no longer have to worry about the 3 months limit during the COVID-19 response. In addition, through this Relief Act, the state will have the ability to grant participants, SNAP participants, with additional funds on their cards, the EBT cards, especially for families and children who are out of school. The federal government also granted the state with additional flexibility to sign more people up for SNAP benefits. We look forward to seeing these changes. Please go to the city's food distribution site map on the city's website to see where there's other sites and distribution sites, and also call 311 for food inquiries. In the last week, we've had over 12,000 views on our distribution map on the city's website. And I truly want to thank all our partners and city agencies for mobilizing in this crisis to feed as many food insecure populations as we can. Our coordinated efforts continues to grow, and it has been my honor to help strategize across all the target populations with the other strong team leads who you'll hear from next. Now I would like to introduce Tisha Edwards, Executive Director of the Mayor's Office of Children and Family Success, who is point on our emergency food response for children and youth. Thank you.
Thank you, Holly. We are encouraged by the quick ramp up to serve 53,000 meals at more than 92 sites across the city since the start of our emergency food response to COVID-19. 43,000 meals, or 81% of the 53,000, were provided to children, youth, and families across 75 sites citywide. This has been a tremendous effort, and it has taken an extraordinary commitment by dozens of partner organizations and hundreds of individuals to make the distribution of meals to our children, youth, and families possible. I want to acknowledge and thank the team that is leading this work. Recreation centers are core to our emergency food distribution efforts for youth. Rec centers have been open for youth every day since last Monday, including over the weekend. The Department of Housing and Community Development staff are operating 3 mobile food trucks and have been going into communities at 15 locations daily, including Saturday and Sunday. DHCD is our main food transporting partner. None of this great work could happen without them. The Family League has also been an incredible partner, providing food to some of our most vulnerable communities and helping with outreach and communications. This week, because of spring break, we began partnering with the Housing Authority of Baltimore City to ensure families in our public housing communities have access to meals. Finally, we have joined forces with many faith-based, cultural, and refugee support organizations who have opened their doors to serve meals to youth this week. And when we needed more sites and more staff, they stepped in. Our goal this week has been to ensure food access across spring break. We are currently operating 75 meal sites. All 42 rec centers and aquatic centers are serving meals daily. All 3 mobile routes continue to serve at 15 sites twice a day. And we have 10 new sites operated by community partners. We are also providing afternoon meal delivery to 8 HABC communities to bring greater access to vulnerable families. We greatly appreciate everyone who has found a way to get involved in this far-reaching effort. The city cannot do this work alone. We know there is growing need as more time passes while schools are closed, families are being laid off from jobs, and our mass transit system is reducing routes. The public health mandate further complicates the food distribution efforts. Nonetheless, we will be resilient, and we will continue to expand our efforts by working with more partners and identifying innovative opportunities to get to more families. We must commit to ensuring every young person in Baltimore knows where they can go to get free meals in the days and weeks ahead. Please help us get the word out. All information about free meals for children, youth, and families can be found at our website, www.bemorechildren.com. And for any and all questions about meal and food access, please call 311. I would like to introduce my colleague, Yang Tang from the Health Department.
Thank you, Tisha. Again, my name is Hyung Tan, Deputy Commissioner of Aging at the Baltimore City Health Department. I want to thank the Mayor's leadership and the Health Commissioner's leadership and the many colleagues here who are working tirelessly to ensure that everyone who needs food during this critical time period gets access. As you heard from my colleagues previously, we at the Baltimore City Health Department and our many partners have worked very hard to ensure that we respond to the COVID-19 pandemic in a way that meets the needs of our city's older adults, as well as preventing the spread of the virus. To help give you a picture of the scale of our efforts, there are 124,000 people over the age of 60 in Baltimore City. In the best of times, 27,000 older adults are food insecure, meaning they are SNAP eligible, as Holly had mentioned. Data from China and other countries has shown that older adults are at risk for dying from COVID-19, and we need to keep older residents safe. This means we need to keep them at home as much as possible and do not expose them to the virus. Therefore, our 3-prong approach to helping older adults is as follows. First, every city resident and partner has a role in this. We want to rally family, friends to support older adults in their neighborhoods. We want to also call on Baltimore City's wonderful neighborhood associations and volunteers to work closely with grassroots organizations to help older adults obtain food in their communities. The Health Department has provided guidelines to these volunteers and neighborhood associations on how to deliver safely to older adults. Second, we are working with our partners in housing, the Housing Authority who own and manage senior housing apartments throughout the city. Our food programs are already in 27 of these buildings, and we need to scale these programs up to enroll any resident who needs support. Working very closely to making the connections at the senior housing buildings, and we'll have updates on the Mapp, as Holly had mentioned. Our third effort, this is where we're focusing most of our attention, is our older adults who are over the age of 85 who do not have a way to get food or do not have family members to help them. We're working very closely with our partners at Meals on Wheels, Maryland Food Bank, Salvation Army, and Red Cross to deliver meals individually to older adults. Currently, our programs are serving 1,900 meals per day with home-delivered meals. We are working to scale this up to 10,000. Over the next week, we are rolling out a public health campaign under the leadership of Mayor Young outlining the above strategy. In the interim, if you have questions around or need resources, call 311 or 211. They will route any questions related to food and older adults to the Maryland Access Point. If you are an older adult yourself or a caregiver, you can call the Maryland Access Point. As the health commissioner mentioned, it is a single point of entry for the city for older adults to get connected for food and other resources. We have tripled our capacity at the Maryland Access Point to be able to field these calls. I cannot underscore enough that the way we deliver food during this critical time period has to be done safely to protect our older adults, our vendors, our volunteers, and most importantly, preserve our healthcare systems that the health commissioner had underscored previously. We all have a part to play in this role, and we're all in this together. Thank you.
Thank you to all for your hard work and attention to detail in executing this critical function. Next, I'll have asked Executive Director of the Baltimore Convention Center, Peggy Dukakis, to come and provide an update for the future use of the building during this emergency.
Thank you, Mr. Mayor. I'd like to let everyone know the Baltimore Convention Center is working with city and state officials to implement Governor Hogan's hospital surge plan, which will add more hospital beds to the state's inventory. Yesterday, Mayor Young and Governor Hogan toured the convention center, where 123,000 square feet of exhibit space will be converted into an alternative care facility. We will have 250 beds available for patients, which will help free up the hospitals to care for more serious and critical patients. FEMA will deliver the medical pods to the Baltimore Convention Center, which will then be assembled by the National Guard. This medical care facility will be operated jointly by the University of Maryland Medical System as well as Johns Hopkins. It will be a prototype for the state of Maryland. The Baltimore Convention Center team will be providing support services to make and keep the medical units operational. Workers who have been displaced will be returning to provide food service, telecommunications, utilities, and other services needed for the care of the patients and needs of the care workers. We are pleased to be part of the team in Baltimore and Maryland to participate in this effort to save lives and to slow down the spread of the COVID-19 virus. I'd like to introduce Dennis Schrader, who is the CEO of the Maryland Department of Health, who will tell you more about the plans at the Convention Center.
Thank you, Mr. Mayor. Peggy, we are moving very, very rapidly to achieve the 6,000 bed target that we have set by Governor Hogan statewide. This prototype will be the first 250 beds. We're working in partnership with the Maryland Hospital Association, who is assisting us with the coordination of the hospitals throughout the state. I really have to thank Peggy and her team, along with the mayor's public safety team. It's been a great joint effort. We're going to be working together closely over the next few weeks as we rapidly prepare for this surge, so when it comes, we will be ready. So thank you again, and we really appreciate the partnership. Thanks.
Thank you, Dennis, for the state's continued partnership, and thank you, Peggy, for all you do over at the Convention Center. Finally, next week is Census Day. I'm here to issue one more call to action for all the Baltimore residents to please fill out the 2020 census on April the 1st. The number of people counted will affect you, your family, and your entire community. So let's make sure we all get counted. The census is easy, and it only takes 10 minutes to answer 9 questions. You can respond online, by mail, or by calling a live person. The census directly affects federal funding for things like this public health emergency we find ourselves in now. Federal dollars reserved for feeding children and older adults are essential to providing food relief during this crisis. It is critically important that we count everyone in Baltimore City on April the 1st. For more information, visit my2020census.gov or call 844-330-2020. Now we'll take a few questions. I can't hear you.
When we get complaints or calls of large gatherings or gatherings of more than 10, and we've dispatched police, and we'll continue to dispatch police to disperse those crowds and to educate people to enforce the social distancing. We've had some of those calls already and have had to dispatch 2 places in private stores to dispatch groups of 10 or more.
Mayor, can we ask you a question? Some mayors around the country have issued their own stay-at-home orders, regardless of what the state may be doing. Have you considered that, and do you have the power to do that?
We've already told workers who are not essential workers to stay home.
I'm talking about everyone, stay at home.
Well, everyone, I think the governor has asked everyone to stay home as far as the state is concerned, and we have asked everyone in the city to stay home. And my county executives around the state, who I talk to every day at 2 p.m., has asked the same question. So we're asking people to stay home.
But you're not ordering people to stay home.
We're asking people to stay home. We're doing everything we can to protect all employees, but I have Matt Gerback, the acting director of Public Works, to come in and address that.
Thank you, Mr. Mayor. We have enough supplies right now. We have gloves, we have masks. We are providing those to the employees. We are enforcing them every day. When before the shifts go out, there is a meeting with all of the drivers and the laborers to make sure that they wear them. And they are running low, but we do have supplies now. We're actively working on getting more. We're working with the EOC and others to get them. But we do have supplies currently. Well, for the workers on the trucks, most of the time they are actually walking behind the vehicles. They would be in the vehicles, though, when they get from the actual location in the yard to the first area of the route.
So the governor, as well as the federal government, have released priorities around who should be testing. And we talked a little bit about that on Monday, that it really is focused on hospitalized patients, as well as symptomatic frontline responders or symptomatic healthcare workers that may be exposed. So at this time, we're still talking through testing capabilities and waiting for additional tests to come to Maryland.
Dr. A, some of the research has shown that the virus is clusters with family groups, workplace groups. What can you tell us within privacy guidelines about the patients that are confirmed in Baltimore City?
Yeah, so I think a lot of the patients that we're seeing, as you mentioned, they're clusters. So certainly there's a risk if you're a healthcare worker just because of your exposures. We want to pay special attention to our high-risk groups like congregate living facilities, knowing that, again, if one person gets it because of the close quarters, it is likely to spread. And certainly if you're living with someone in your own personal space, that there's a risk of easier spread.
Do you have anything in the city that you would consider a hotspot?
So no, not necessarily a hot spot, but again, I think we want to make sure that we're protecting our high-risk population. So certainly, again, our congregate living, our first responders, and our healthcare workers are on the top of that list.
All right, thank you, guys.
Now, we want to hear from the Director of Homeless Services today. Did we hear from the Director of Homeless Services?
She will be talking tomorrow. Thank you.